Frequency Podcast Network. Stories that matter, podcasts that resonate.
If it gave you a little shiver when you heard the news, I don't blame you. Some of us have PTSD, and I don't use that term lightly when it comes to the World Health Organization declaring a global health emergency after seeing thousands of new cases of an infectious disease spreading. A new strain of Mpox, thousands of children stricken, news of fatality rates and replication numbers, and all the rest that you remember. You could be forgiven for wondering for just a second, what if? But is there really cause for concern here? A reason for those 2020 flashbacks? What does turn a virus like this from a concern into an emergency and then into a pandemic? And do those conditions even exist here? It does seem inevitable that cases of the new strain of Mpox will show up in Canada. Are we ready for it? What do you need to know to understand how much of a danger this is or isn't? I'm Jordan Heath Rawlings. This is The Big Story. Dr. Jason Kindrachuk is an assistant professor in Medical Microbiology and Infectious Diseases at the University of Manitoba. He is also the Canada Research Chair in the Molecular Pathogenesis of Emerging Viruses. Hello, Dr. Kindrachuk.
Good morning.
Thank you for finding some time for us. It's probably, I imagine, a fairly busy time in your life.
Yeah, this has kind of been the way really since, 2020 and even a little bit before that. At some point, you just kind of grow used to, whatever else is going to be thrown our way.
Well, speaking of what's been thrown our way, for those who managed to miss the information about this virus when, I guess it first or most recently made headlines a couple of years ago in Canada, just let us know, what is Mpox?
Sure. So Mpox is actually the disease that's caused by monkeypox virus. Monkeypox virus is in the same family of viruses as variola virus. Variola is what led to smallpox. Obviously, we know that was eradicated in 1980, but it's not exclusive to those two. We also see cowpox virus and vaccinia virus there. And monkeypox virus has been circulating in Africa, in West and Central Africa for at least 50 years. That's when we identified the first human cases back in 1970. And really, in the past couple of decades, we've seen an increasing trend of infections, mostly in Democratic Republic of the Congo, which has had the greatest burden of disease across all of the endemic countries in Africa, followed by Nigeria.
In a minute, we'll talk about how things have changed recently. But maybe first, you mentioned it's in the same family as smallpox. What are the symptoms and just how dangerous is it?
Yeah, the kind of the knowledge of this continues to expand almost on kind of a weekly basis. If we look at this historically, up until 2022, the kind of clinical descriptions and presentation of disease was fairly straightforward. Mpox looked very much like smallpox. You had this fully disseminated lesional disease, mostly the hands, face, arms, legs, feet, and hands. And all of those lesions tended to be in the same stage of development. So, whether a lesion was just starting or was starting to crust over on your face, if you looked at one on the foot of that particular patient, the exact same thing. The different factor between smallpox and Mpox really was this kind of profound lymphadenopathy that we tended to see, which is really a swelling of the lymph nodes. We didn't see that in smallpox. And then the overall disease severity tends to be lower in Mpox. Variola virus for smallpox was up to a 30% case fatality rate. Certainly with Mpox, we've never seen anything close to that. Most areas kind of 5 to 10%, but that's pretty variable with 10 being on the very high end of things.
So you mentioned it's been circulating primarily in places in Africa for almost 50 years. We saw a brief outbreak of it, some of which made it to Canada a couple of years ago. But it is now, as of last week, the World Health Organization has declared it a global health emergency. Explain what exactly that means.
Yeah, it's a good question, right? So the global health emergency comes back to this idea of, the declaration of a pandemic. We no longer hear about declarations of a pandemic. The declarations are now a public health emergency of international concern. Same thing as we saw with COVID. these are events where we see basically the broad and rapid distribution of a new emerging infectious disease across many different areas of the globe. So moving out of areas where we traditionally have seen the virus and then, circulating to areas that were either not endemic or who have historically not reported cases in the past. That, for us, is really what we're seeing right now, right? We've seen rapid expansion of the virus within the Democratic Republic of the Congo the past 20 months, but we've now seen this movement into surrounding regions, including Burundi, Rwanda, Kenya, and Uganda, and concerns about a greater potential for international distribution of the virus.
What is different now about this virus from a couple of years ago when the same things seemed to be happening, but never, I don't want to use this in a difficult way, but never got off the ground, never took off?
This is a fantastic question. Really, in 2022, to be quite fair, we did see it actually take off very, very well, right? We saw the introduction into Europe, those kind of earliest cases that were identified in the UK, and then very rapid geographic spread, but really within the span of weeks to a few months, so obviously including Canada and the US and others. What was kind of really different about that particular outbreak was the fact that we saw cases strongly overrepresented amongst men, but also overrepresented within men amongst those that identify as gay, bisexual, or other men who have sex with men. And all of the events that we were seeing in terms of transmission seemed to point back to these very close kind of, extended contacts with a particular emphasis on sexual or intimate contact. That continues to be the case still even in 2024. The virus never disappeared from non-endemic regions. Following 2022, we were able to get things suppressed very, very well, but we've continued to see pockets of and clusters of cases in distribution. In DRC in Central Africa, it's a little bit different of a situation, right? So what we're seeing on the ground right now is rapid geographic expansion within the Democratic Republic of the Congo. Most of those cases are still related back to zoonotic transmission, so contact with wildlife. We're still seeing an overrepresentation of cases amongst children under the age of 15. That's where we tend to see the highest mortality and morbidity within Central Africa with their particular type of monkeypox virus. But we are also seeing now this kind of, this additional subclade, clade 1b, that we reported on a few months ago, where we're seeing sustained human-to-human transmission. So we're seeing a couple of different things happening in DRC, and that complicates our ability to try to get things contained and try to get good, thorough response activities moving forward.
So you're saying this is a new strain of the same virus that may transmit in a different way?
Yeah, it gets a little bit confusing, right? So in West Africa, we have predominantly seen clade 2 monkeypox virus. Central Africa, we've predominantly seen clade 1 monkeypox virus, really the division line being Cameroon, the only country where we see both clade 1 and clade 2 viruses co-circulating. Clade 1 has historically been associated with more severe disease, and clade 2 is what we saw globally in 2022. What has kind of changed is, again, going back to 2022, we saw suddenly this kind of sustained human-to-human transmission globally with monkeypox virus that didn't require any animal contacts and it wasn't precipitated by animal contacts. Clade 1 historically had never shown that previously. Now we're starting to see that. We've seen mutations within the virus, within a particular gene that we think is related back to an increase in sustained human-to-human transmission. So what this means going forward, we don't necessarily know, but it complicates our ability to try and get the virus contained, certainly within the complex situation within Congo.
So are we seeing this new lineage of the virus spreading beyond Africa yet? And whether or not we are, given the way you've described its transmission, is that inevitable?
Yeah, I mean, I think the reality really going back to 2023 was, many of us that were on the ground, I think, felt that we were going to be in the situation we are in now. Certainly with the additional international spread within the African continent, I think we were very, very concerned about areas that shared adjacent borders with Congo, certainly Rwanda, Burundi, Uganda, Central African Republic, and others. The larger international piece, again, I think we were concerned about because of what we saw in 2022 with that movement of virus out of Nigeria and inevitably into global areas. I think we're in a different situation. Clade 1, Clade 1b, at the very least, we're seeing more sustained human-to-human transmission. But to be fair, from a global standpoint, certainly in high-income countries, there's vaccine available to groups that are at increased risk for infection. There's increased surveillance and diagnostic testing. But there's also a massively increased awareness amongst not only healthcare providers, but also amongst communities that are at increased risk for infection. So all those things play into our favor to identify cases quickly. We've seen that in Sweden recently last week. We will likely see additional cases, but I think the bigger question is going to be, do we see any ongoing transmission within the communities, within the areas where we see those cases being identified?
So when you look at what's here in this country, as you mentioned, there's a vaccine for this virus. We were giving it out a couple years ago to stop spread then. Are we ready? Do we have enough vaccine to go if we start seeing clusters of cases? Do we have public health officials on the case here? Are we doing surveillance? What's the status of all that?
It's a great question. I think the question about are we ready, it brings up a lot of I think a lot of concerns and folks that work kind of within the global health sphere and the emerging infectious disease sphere, because I don't think we've never been ready, right? And I think we've slowly kind of moved towards greater readiness, but I think we're always kind of in this realm of being underprepared. For this, I think we're not prepared in the sense that we know where the source of these viruses are, and that's really Central and West Africa in the endemic countries. We haven't kind of dealt with shutting off the tap to stop the distribution of virus locally. And really that gets down to vaccination programs. In high-income countries, yes, I think we are much better prepared than we were in 2022 for that recognition of cases. There's a big piece of this still, though, which comes back to this idea of certainly the stigma that has been attached with Mpox, either within Africa or as well with cases globally in 2022. And trying to provide information to people and help people feel comfortable with coming forward to self-report cases. Again, we're dealing with a disease that is, in the vast majority of cases, causes mild symptoms, but we still want people to report. Your likelihood of having a good recovery is very, very high, but there's a potential for onward transmission if you don't report. So I think that's the concern that we all have. It's that cryptic transmission and unidentified transmission.
So I just want to ask, because, when I asked you what a global health emergency was, you sort of compared it to the way this is how the WHO would now say that there is a pandemic. This doesn't sound, and I'm asking this because people hear these terms and they wonder, this doesn't sound like that. Like, how concerned are you? How worried should people be?
Yeah, I think from a global standpoint, kind of outside of sub-Saharan Africa, in high-income countries, I think that the risk continues to be quite low, right? We've got vaccine stockpiles in many countries. We have vaccination programs that are up and running. We have testing. We have surveillance. We have good informational awareness, and really good connections with community organizations for distribution of information. My concern goes back to the idea of we haven't gotten to the source of this, which, my particular, kind of area of the world that I work in a lot is Central Africa. We've seen 30,000 cases of Mpox in the last 20 months, way higher than we've ever seen previously, and certainly far above any annual average prior to that. My concern is the fact that we're no closer to getting this contained than we were a month ago, 2 months ago, 6 months ago. We're moving in the direction, but I think the wheels to get vaccines deployed and to get better surveillance up and running and get better healthcare infrastructure, all those things take long periods of time. So from that perspective, I'm quite pessimistic about where we are. I think we're making progress on the ground, but it's really been through shoestring budgets and pooling of research dollars amongst different global collaborators where we can.
You mentioned earlier that, with this new lineage, we're still sort of learning new things as we go. What are the chances that there is something going on with this virus that we simply don't understand right now?
Well, hey, I think for us, quite honestly, when I talk about the idea that it's been circulating for 50 plus years now, we've had basically, since 1970 to be able to get a better perspective on what this looks like. So I think we're quite knowledgeable on disease presentation. Certainly the zoonotic piece, the wildlife piece, I think we have a pretty good idea of how those contacts are made and what those look like. We know the particular populations or groups that are at increased risk for infection. All of that is really part and parcel because of our colleagues locally on the ground in Congo, Nigeria, and other areas. So I think we know quite a bit on that front. The piece where I think we're learning a lot very quickly is the idea of viral evolution for monkeypox virus. It's something we hadn't seen really happen in kind of short order previously. 2022 taught us that, there is the potential for this virus to evolve and evolve fairly quickly to greater human-to-human transmission. We've seen that very rapidly in DRC. That's the piece that I think we need to understand. And then the other piece really gets back to the idea of our perception and perspective of clade 1 versus clade 2 is based on this inference that clade 1 is associated with more severe disease. Historically, yes, the data aligns with that, but that's also been in kind of pockets of information that we've gotten. I think right now we're getting a better perspective that maybe some of those division lines may be a little bit blurry, and it may very much be based on particular context of exposure and route of exposure, and certainly the age group consideration.
I know I asked you how worried you were as, a professional who deals with this stuff every day. But when we talk about emerging viruses on the show, as we have done a lot over the past several years, one thing I want to ask you is, how concerned should the average person be when they see these headlines, which, as I mentioned, can use a lot of hyperbole? We're trying not to do that, but I know a lot of people have a lot of trauma and anxiety about this kind of stuff, having lived through just how awful COVID was and lost loved ones and spent months indoors, and to see the same thing, even though it's nothing like that, presented this way, can really trigger some people, for lack of a better word.
I have family members and close friends that reach out to me all the time when this stuff comes up and ask, how worried should I be? Absolutely. I completely appreciate that and understand the reasons behind that. I think my perspective on this is really in high-income countries and certainly, thinking Canada very specifically, our risk for, expansive, clade 1 introduction into Canada and movement into wild animals and kids getting infected and those pieces, very, very low, right? The considerations still need to be what's happening in Congo and the moral and ethical reasons why we need to be responsive there. But I think we also need to appreciate that what kind of came out of 2022 was, I think, this very easy ability to forget that we still had Mpox within the country, right? So it essentially the cases, were suppressed very, very quickly, but the virus didn't disappear. And I think that's one of the things that I get concerned about is we kind of live almost kind of based on the headlines of what's coming next. We follow along with the headlines information, and then as soon as it's not being presented, we forget about it. That's the piece where I think we need to do a better job to ensure that communities that are being affected, we continue to appreciate the struggles that they're going through, but also ensure that their access to vaccines, their access to testing, their access to information continues beyond our perception of what the current threat is.
Do you get the sense that governments are doing that and they're taking this seriously?
I think so. I think coming out of COVID, we learned a lot about misinformation and disinformation, and of course, the importance of community engagement. Mpox was very, very different because that particular 2022 global outbreak was very focused within key populations. Again, men and those specifically that identify as GBMSM. One of the things I think we learned coming through COVID and then through 2022 was that we don't have a one-size-fits-all for community engagement and information dissemination. We have to be able to tailor that to the particular population while also ensuring that community groups, community activists are all involved in essentially creating that communication structure. So that importance of community-based research, I think, has become so important. And I think we've learned a lot. So many of the panels I've sat on the past year and a half or so on this, and certainly more recently, we've been talking about that and talking about that in the context of Africa, the context of Canada, the context of the US, context of Europe. So I think we're moving in that direction.
Dr. Kindrachuk, thank you so much for walking us through this and keeping a level head.
Absolutely a pleasure.
Dr. Jason Kindrachuk of the University of Manitoba. That was The Big Story. For more, you can head to thebigstorypodcast.ca. There are plenty of episodes about infectious diseases in our back catalog, as you might imagine. You can also find happier things there, or more interesting things there. Whatever you're looking for, there's thousands of them. You can send us feedback on this episode or any other by emailing us at hello@thebigstorypodcast.ca or by leaving a voicemail when you call 416-935-5935. The Big Story is in every podcast player and on every smart speaker. Just ask it to play The Big Story Podcast. Thanks for listening. I'm Jordan Heath Rawlings. We'll talk tomorrow.